You will have recently received a letter from Morriston Hospital confirming that you've been referred to the cardiology department for a TAVI procedure to treat the symptoms of aortic stenosis. This short film will explain what aortic stenosis is and what you can expect before, during and after your TAVI procedure.
Aortic stenosis is a heart valve disease. It results from progressive stiffening and narrowing of the aortic valve, which stops blood escaping from the heart into the aorta, which is the main artery that takes blood to all parts of the body. Aortic stenosis results in symptoms of breathlessness, chest discomfort, dizziness and even collapse. If left untreated, symptoms are progressive and we can expect 50% of people to have died after 2 years from onset of symptoms.
I consider myself to be very fortunate to be alive and well at this time. In the last 12 years, I've twice been diagnosed with aortic stenosis and twice had my heart valve replaced, first in 2006 and then in 2015. 8 years after my first valve operation, I began to feel unwell. Wheezing of the chest, my legs were swelling with water retention, and I could not lie down in bed flat at night. I had to have several pillows to prop me up, and that went on month after month. I could see that I was in trouble again.
You've been referred to the Morriston for a TAVI. That's transcatheter aortic valve implantation, a less invasive procedure for those unable to undergo open heart surgery. A new valve is inserted in the groin and fed up through the femoral artery and placed inside the old one. Alternatively, it can be inserted via a small incision between your ribs. This is called the transapical or transaortic procedure.
TAVI is a less invasive and therefore less traumatic procedure for the patient to undergo. It does not involve opening the chest in most cases, and it does not require the heart to be placed on a heart-lung bypass machine. Recovery from a less traumatic operation is quicker, and most people will have returned to normal functioning within weeks as opposed to months for an open heart aortic valve operation. For me, the introduction of TAVI has had a profound effect on the management of heart valve disease. We have known for a long time that the majority of people with heart valve conditions do not get referred for surgical treatment. We now have a less invasive alternative, TAVI, which results in more people now being discussed in multidisciplinary team review for potential valve intervention, whether that is open heart valve surgery or TAVI.
Your cardiologist will explain what further tests you will need before your TAVI procedure can take place.
So we've decided that TAVI is the most appropriate treatment for you. What we need to do so we can gain the information needed to perform the TAVI procedure is perform 3 tests as a day case that will give us all the information we need. Firstly, we need to perform an angiogram. It tells us the nature of your heart arteries, which I'm pleased to say in your case are not narrowed or blocked. Secondly, you will need a CT scan. This again, normally takes about 15 to 20 minutes to perform, and it will tell us the state and nature of your leg arteries to tell us which route we can use to implant your TAVI valve.
In the CT scanner, you'll be told to lay on the table, put your hands behind your head, and the machine will move up and down your body. You'll be asked to hold your breath for a certain amount of time.
The third test that you require is an echocardiogram. This is an echocardiogram ultrasound study of the heart, and we're focusing on this structure here. You can see that the bottom part of the valve is thickened and immobile, whereas the top part of the valve is mobile, albeit it is also thickened and abnormal. So we now have some answers as to why you have a problem with the symptoms of breathlessness and fluid retention. This gives us more detailed information about the size of the valve that we will implant, and it will also give us important information about the function of the rest of your heart.
The hospital will arrange the 3 tests, which will last about 30 minutes each. You'll be in the hospital for about half a day.
The decision to offer a patient either TAVI or open heart valve surgery is made by a multidisciplinary team. This team will consist of cardiologists, cardiac surgeons, anaesthetists, and also other healthcare professionals. We will then make a joint decision as to the best treatment for that individual patient. We think on balance with all of this information that it would be safer to perform the TAVI procedure as opposed to reopening your chest for a second time, which we think will carry a higher risk.
I understand, yes.
About 3 weeks before you go into hospital for the TAVI, you'll be asked to attend a pre-assessment consultation, where the nurse will take swabs out of your nose, throat and groin. She'll also take some blood, and you'll get the chance to ask about the procedure. Shortly after the pre-assessment, you'll be sent details of what you need to bring with you to the hospital for your procedure. After you've settled into the ward the day before the procedure is scheduled, you'll get a visit from the cardiologist.
I go over the procedure again with them. I ask them if they have any questions. I will explain that there will be a team of clinicians who will be performing the procedure to make sure that wherever possible we can ensure the best possible outcome for the patient.
The next morning, the theatre team will collect you from the ward and take you to the cath lab where the procedure is performed and will usually last approximately an hour.
When I woke up after the TAVI operation, I was very, very much at peace. I was also in the care, dedicated one-on-one care of an excellent nurse and in the intensive care unit at Morriston. I couldn't have wished for better treatment than I had.
You'll remain there until your doctor feels that you can be transferred to a regular hospital ward, where you will continue to be monitored until you're discharged from the hospital, usually within 3 to 4 days for the transfemoral and 4 to 5 days for the transapical procedures.
One of the great benefits of TAVI is the recovery period for the patient. With TAVI, you can typically look at a recovery period of just a few weeks compared to months for a surgical open heart operation.
Within a day or so, I was able to walk around with all the things attached to me, but I felt strong and looking forward to my new life, looking forward to that. And I was filled with optimism and pleasure and also deeply appreciative of what had been done for me, as we all should be.